Hello everyone and welcome back to my YouTube channel. If you are new to my channel, my name is Martine Chiella and I cover content related to motherhood lifestyle as well as faith. In today's video, I'm going to be going over postpartum update for both a mommy and a baby after C-section. So the first thing I'm going to start off with is breastfeeding. So for mommy, for myself, when my son came out, I did change my mind a bit. I did not want to just exclusively breastfeed because I realized the difficulties with that is that you're not able to receive the help that you are looking for if you have a partner that is helping you feed the baby. So you can't really do that unless you have already supplied the milk pumped in advance. So I decided to give him milk when I was at the hospital. I was like, listen, my baby is hungry, okay? I wanted him to be able just to sleep properly, unlike other babies in that unit crying because they simply gave them the clear liquids that they say it's good for you. I mean, not saying that nothing wrong with the liquid, it's just not enough, okay, for at least for my baby. So I decided, I was like, you know what, I'm gonna give my baby some formula while I wait for my milk to come in. So it ended up coming in like between 2 and 3 days. So that's when it ended up coming in. The second time around here for my baby, when the milk came in, I did not have that first time problem that I had with when you were really engorged and it's really just difficult. Didn't really have that this time. Maybe because my body did stretch that maximum already. I'm not quite sure, I should say. Because I had a C-section, so resting and activity are quite limited. The first time around, it was very difficult on my body. Didn't get up right away to do a lot of things that I was able to do this time around with my son. I credit that to a little bit of walking, which I've been able to do, and also a posture. Posture was everything this time around. I think also the difficulties that I faced with the first C-section is simply because my body had a very harsh traumatic shock having a C-section. When you've had medication, an epidural, or anything like that, oftentimes a few people experience this, and I did experience this, which was you get like that itchy sensation like under your skin and you just want to scratch. So I got that itchy sensation the first time, and the second time around I got it again, but I was quite equipped differently in taking care of myself. So in caring for myself this time around, it was a little bit different than the first time. So the first time I experienced a infection because I was not taking care of the area properly. I was exposing it to water. So the difference here this time of what I was doing was that every time I would shower, I was showering in a very strategic way, so just wetting portions of the body that I'm handling and moving on to the next portion, not allowing a lot of water to get into the area. The second thing that I did once I showered in those techniques was that I was blow drying the area to maintain it dry. So every time I would go in, I would pat it down, wipe it, pat it down, and blow dry the area. Now there wasn't any tape left over on top. It was only the stitches that were left to dissolve on their own. So I applied gauzes in the area there. So that helped me out this time around. The first time around, I just wasn't quite sure what I was doing there. Probably didn't listen to the instructions properly also. Another thing with caring for myself this time around was that I continued taking the painkillers, the medication, which is the Tylenol or Advil. You would take it just according to what's written on the instructions there. So that's what I took this time around just to help me out. I was able to take it for about a week after I came back home because the pain, when you come back home, that medication that is inside your body starts wearing off. So you do need something to assist you to go along. So it might take a couple of days for that pain to kind of ease down a bit. The thing I'm going to be just going over is taking care of the baby when you get back home. So with feeding the baby, I decided to do both. I decided to do breastfeeding as well as bottle. Now this time around with newborn babies, when you do get home, they do advise you to take inventory of how much they're feeding, how many times their wet diapers and nappies are. so that you just have an idea of what's going on, and that you're able to relay that information over to a health professional if anything arises with the baby, and they'll be able to advise you in a much better direction. It was a little bit different with me this time. I didn't really jot down all the notes, like the nappies and how everybody usually does it for a newborn baby, the amount of times the baby is feeding. I try to start it, but it's just so difficult to kind of like keep up when you have to feed the baby. If you have to kind of like, reach for an app or reach for a paper and pen and write, I find that a little bit, it's hard for me to maintain that. If other people, I notice like other people can absolutely do it, and when you're a first-time mom, it's the only thing that you know how to do, and you tend to gravitate towards that right away, and it's fine. It's good. It gives you that sense of security, that peace of mind that you are feeding your baby enough, and everything that's supposed to be happening with your baby is happening. So with me this time around, it was slightly different. I didn't write down anything when I was feeding him. I just kind of went off of, I was just reading the baby, and you start learning how to read your baby when you get home. You start noticing it when the baby's hungry. They'll be turning a particular way. Those are some of the things they also kind of go over with you when you're at the hospital, when you are feeding them. So the techniques and the things that they went over with me at the hospital on how to feed my baby, those are some of the techniques and things that I've retained with me when I got home. And having my first daughter, I was able to be confident in myself in kind of going over the feeding methods. So I knew he was getting enough food simply by watching the way that he was swallowing. And I think they explained that when you're seeing that the baby is taking a certain amount of gulps, and you're able to see that from here, and they're full gulps where they're actually swallowing if there's something in their mouth. The other major thing I would say for taking care of the baby is simply knowing how to shower them when you do get home. When they're newborns, for new moms, you have that nervousness when you start off showering the baby the first few times, because they're just so small and fragile, and you just want to do everything the right way. So those nerves, I didn't have those nerves around the second time. Second time around moms, I believe they would agree with me here. So just making sure that you are showering the baby properly, you're not putting too much product in the baby's face, or wiping the baby properly. There are methods highlighted all over YouTube, professional methods on how to shower a newborn baby. They're on YouTube, you can find them, and that would be able to assist you if you are looking to just recap before you jump into it. I know as a first-time mom around, when I wanted to do something and I wasn't confident in myself, even though they went over it with me, I was okay to jump on, ask the questions that I needed before I actually venture off and actually did what I had to do. So not wetting the area of the baby, the umbilical cord area, just tapping it dry. That was the only thing that was that needed to be remembered. And also not really showering the baby every day right off the bat is something, 2 tips that I would say you would need to remember for taking care of baby when it comes to showering. And when it comes to the baby resting, if you have a crib, a bassinet, anything like that, there's not one particular thing that I would recommend over the other. But for my son, I decided to go with a bassinet right off the bat. Right now, his update is that he is 3 months, so he already moved out of his bassinet. So he started off in his bassinet because it's just a little bit on the bigger side. So we already moved off out of the bassinet. And just ensuring a safe place for your baby to sleep, ensuring that you are meeting all the guidelines that they have advised. As a first-time mom, it's already difficult enough to have a lot of things on your mind. Don't be so quick to leave all of that decor and stuff inside the baby's bassinet, crib, or wherever you're going to be putting them. I know other people do different methods of putting their baby to sleep, like co-sleeping and so on. I wouldn't recommend that, and I personally wouldn't do that. I don't do that. I didn't do that with my babies. And when the baby slept, I just put the baby in their sleeping area. So that is it for my update for both myself and my son, postpartum updates with the C-section number 2. If you like this video and like this kind of content and would like me to cover more content related to my C-section experience or anything related to a newborn, leave me a comment down below. Let me know how your experience was the second time around with baby, coming back home with baby, and give me a thumbs up. Thank you so much for watching. Bye.